number one thing is that the later you call in the day, the more effective the phone calls will actually be. So if you call from 5 to 6 p.m. or 5 to 5:30, you're actually twice as likely to reach your overdue patients. So you can cut that number right in half right up front, and that will improve your system and your success right off the bat. Another reason that recall consistently doesn't happen within practices as well is because, okay, there's a gap in the schedule coming up. Let's have the hygienist or the office manager or someone else begin to call for an hour or two. But the most important thing that we can do is make sure that there is a set aside dedicated time every week happening for recare. And the final thing is, it's just not another task, even though we wear tons of hats, because it is a game changer for a dental office as we looked at those past results.
I think I would add one more to that, your list. Like I said, and you just mentioned it too, set aside time, have somebody make the calls. The other thing I'm going to mention is I don't think that we're training the team members well on how to handle that call. There's a purpose behind the call. And if we have a dental assistant making the calls and a hygienist, and you say, here, make these calls, they don't understand how to handle the calls, how to leave a message, what to say to the patient, what their purpose is with the call. It's just making phone calls, but we're not actually working to reactivate or get that patient scheduled in the most efficient and best way. Do you agree?
Absolutely. And what we're going to talk about right now is how we can build the most effective system and use the most effective scripting so that these calls are effective in the short amount of time that we have. So how to build an effective system? First of all, we have to set aside time. If we call during the day from 9 to 5, you're going to see about 91% voicemails. If you call after 5 p.m., even if it just be for 15, 20, or 30 minutes, you will receive about 80% voicemails. Now, that may not seem like a drastic change, but you're twice as likely to get on the phone with people. And they're not rushed, because if you do catch them at work or you do catch them picking up their kids from school, they often don't have their schedules in front of them. And so you're catching people when they're finally getting home and they have a few minutes where they can set aside and schedule this appointment. Another thing that we can do to build an effective system is keep track of the calls that are made. Because oftentimes we will call Greg and he'll say, actually, you know what? I've gone to Florida for the next 3 months. Can you call me later? And instead of just marking that down within the system, we're trying to make as many calls as possible. And so we're not leaving notes within the system. And that means we may call Greg in a month or two when he's not even back yet and not able to schedule. So inactivating patients only when needed, as Laura said, and leaving copious notes actually will make you more effective over time, because you'll not be repeating the people who are not able to schedule at that point.
I would add to that too, because I agree with that. I think putting in notes and getting a commitment from the patient. So let's say Greg says, I'm going to be in Florida for 3 months. And you say, okay, great. So I'm going to put a note in here. We'll call you in 4 months when you're back in town. And then I just want to make sure we can go ahead and get you scheduled then. Getting a commitment from the patient. If I call you next Tuesday, will you have your schedule in front of you so we can get you scheduled? It's not just the commitment of, it's a small verbal skill, but it's not just the commitment that can I call you back, but it's the commitment from the patient to say, yes, we can schedule it at that point. Now, they may still try to push you off, but after a couple times of committing to you that they'll schedule that appointment, you're eventually going to break them down. You're going to get them to schedule. So I think adding notes and then making sure you're clear on what the commitment was from the patient in your notes is important.